Okay, hi everyone. I decided to do another video today and instead of being in the backyard, I'm going to take you on a road trip. So I'm here with one of my favorite people, Dr. Marco, who's my chiropractor, one of my chiropractors. My other chiropractor's over there, but he's a little camera shy. That's Dr. Tim. They're my chiropractic team. And I've been seeing Dr. Marco for probably 4 years now. I'm here probably 3 days a week, and through chiropractic, I've been actually able to get lots of relief from my hip. But being overweight, Dr. Marco would tell me all the time about how that affects my health. And what I wanted Dr. Marco to just talk briefly about today is how carrying that extra weight. If people saw my pictures that I posted yesterday, my before and after, I mean, I was carrying around, about 13 months worth of baby in front of me and still have a way to go. But how did me walking around with that extra weight, how was that affecting my spine and my posture, how I carried my body?
Absolutely. Well, thanks for inviting me on this segment right now. The first thing that we always have to understand when it comes to the spine, the best way to tell if you have a good or bad spine is to look at your posture. So the worse your posture is, the worse your spine is. So that's the first thing we want to know is, do you have good posture? If so, that's something that we would want to know. Then you got to look at, okay, so you don't have a good posture, so you have stress on that spine. Now you're going to put on excess weight from the foods that you put in your body, the lifestyle that you've lived, have put on this extra weight. Now not only do you have stress in the spine because of your posture, now you're adding excess weight. I mean, he was joking around about he had a 13-week-old belly. Pregnant women is a perfect example. Pregnant women, when they have that belly growing, they start to tend to have some lower back pain, maybe some neck pain, because they're now changing the structure of their spine during that period. So it's important to know how you can lose that weight so you could take that extra stress off, and then obviously taking that next step of going to a chiropractor to fix the spine, and then now you have the best of both worlds. So that excess weight is going to add to the stress of that abnormal posture that you have.
Because I mean, what I found in my body that you have to compensate, right? You have to, in order to manage that, you're shifting. You may not even know. And I know when I first started getting my regular adjustments, I had been walking wrong all along because I was favoring the hip, right? And I was compensating for that. So once these guys started to fix that, I started to get some problems in my other leg, that plantar fasciitis, right, which is incredibly painful because now I was started to walk the right way.
Absolutely.
So you don't realize when your body is out of balance, whether it be being overweight or your bad posture. It just affects. It's a ripple effect. It just affects every other function of your body. So,
yeah, absolutely. Nobody realizes, if they've never been to a chiropractor, the mobility that your spine has the ability to have. And that's what a chiropractor does, is they adjust those joints to give your body the maximum amount of mobility that you can have so that you can go through the life and have the stresses of your life and still be able to stand that. So that's something we would want to be aware of is, get the joints adjusted to get that mobility, have as little stress from any type of excess weight, and you even compensate with the belly. So if a man or a woman has a larger belly, either through pregnancy or just being overweight, that's going to cause your center of gravity to come forward because it's pulling you forward. So now you have to arch your lower back to hold that belly up. So that's going to really accentuate that bad bigger posture. So you're going to get a lot of extra stress on that. So there's a lot of things that can be changed by taking off that excess weight in addition to adding other lifestyle changes as well.
Right. And I have to tell you, I know there's probably a lot of people watching this that think chiropractic is just to get you out of pain. Like, oh, my back hurts, I'm going to go see a chiropractor, and then 2 weeks later you're off. But there's an incredible system of maintenance of keeping your body in the right place and your spine in the right place so that you just remain healthy. And that's why I personally, and actually my entire family, comes here on a regular basis just for overall well-being. And my kids being away at college, they're away for the summer now, but being away at college. My son especially is bummed out that he can't come and see these guys and
He
get
makes
regular
his trips,
adjustments.
though.
He actually came home over the summer from camp and changed the schedule around just so he could get an adjustment. So that shows you. But a lot of people who have never experienced it, is it all right if we show them my adjustment today?
I'm
So
perfectly
you
fine
can
with
see
that.
what goes on. And I'm a big baby, so and I know when I started, right, I used to scream a little bit in here. So we're going to go into the adjustment room, and we're going to, Dr. Mark, let's say that.
This is gonna be ugly.
And let's do it here. We'll put the camera right here. We'll see if you can
Now, am I gonna
see.
Am I gonna block
Well,
that
you
camera
may
if I
you may
stand?
block a little bit, but you are the doctor. You're going to have to.
maybe come
So-
maybe come this way?
You want me to hold it?
Yeah.
Actually,
Well.
Dr. Tim could hold it.
Want me to hold it?
Yeah. Okay. Let's
Alright.
try that. We're gonna turn this around. Okay, so that's the back facing
Okay.
camera. So
I got it.
Dr. Tim's gonna shoot this.
Cool.
So this is the table,
It's the
right? The
adjusting
adjustment. Okay.
So I
I
can even
fit a
talk
little
to-
better on the table now.
Yes. It's amazing how well he's done. Yeah, so what we do is we just feel the spine just to find out where most of the stress is. Now he has a forward posture in his neck, so we always seem to see a lot of stress in the mid back here. So we kind of just see what's going on here. We tend to like to use a vibration massager to relax those muscles. So actually, I'm going to use that on him. Kind of helps to calm down the patient a little bit, also to relax those muscles to make the adjustment a little bit more effective.
And you talk funny when you
Yeah.
have this being done.
The kids love this one. They start making some funny noises when they play with this thing.
Who doesn't love this? So this kind of loosens things up.
Absolutely. Could even get in the shoulders here. So sometimes when people get adjusted, they hear a sound, it sounds like cracking, but actually that's gas being released from the joint. So you may be able to hear it, you may not be, but that's just that gas that gets locked into those joints, and then when you release that joint, that sound is what you're hearing.
So is that like when you crack your knuckles? And you hear
Exactly.
that?
It's kind of like when you crack the knuckles. So we're not actually cracking
no
any
bones
bones.
are
We're not
being
breaking any
injured.
bones. It's just we're finding an area that needs to be adjusted. We find that. We could even have them take a breath in for us. So take a breath in for me. Let it all the way out. You push down lightly. There we go. Sometimes you make some noise, but it's usually a little relaxation.
Mhm.
Same thing here. We're going to get the shoulders here. Perfect. All right. We're also going to get his lower back, so we put them on the side. So he's going to come on his side, this side up.
How am I looking, Dr. Tim?
So,
Are you getting my good
handsome.
side?
So handsome.
And sometimes he's got a tough lower back, so you don't get that sound.
Oh, there it goes.
There we go.
Other side. So we just basically are trying to just get mobility throughout that spine, activates those muscles and those mechanoreceptors to fuel that nervous system. Good, on your back. Now this is the part that most people are nervous for or scared of, but there's nothing to be scared of. A neck adjustment is as safe as you can get. And we try to do it very gently so that we don't have to scare any patients. We just a little bit of just a rotation, you feel. There you go. Perfect. So that's pretty much how we do the adjustment. Come on up.
I lived through that. No, but it really does feel great, and I would encourage anyone who is even considering getting into good health, make chiropractic a part of their weekly routine. So that's it today, just this video of me getting adjusted and why chiropractic is important both before you lose the weight and as you're losing it and after. So until next time you will see less of me. So that's it. Thanks.
Thank you.